This is White Plains Week, the weekly roundup of White Plains, Westchester, and world news. With John Bailey, editor and publisher of the daily internet newspaper White Plains Citizen Net Reporter, WPCNR.com. Jim Benneroff, editor and publisher of SuburbanStreet.com and WhitePlains.com. White Plains Week, what's happening? Who are the newsmakers? What's in store for the future? The views and opinions expressed on this program are solely those of the participants. White Plains Week is presented on Optimum Cable Channel 76, Verizon Fios Channel 45, and on the internet at whiteplainsweek.com, youtube.com, and wpcommunitymedia.org. Now, White Plains Week.
Good evening, Mr. and Mrs. White Plains, Westchester, and the world at large. Here are the stories of the White Plains Week of December 4th, 2020. Westchester County COVID cases increased by another 3,977 active cases in 7 days. White Plains active cases went up by 43 persons Monday to 254, 65 more 2 days later. White Plains schools continue classes in the schools despite letter from school unions to the Board of Education and the Superintendent of Schools suggesting suspending in-school instruction to prevent spread. Superintendent Ricca says White Plains schools are not close to being declared a yellow zone. Governor Cuomo proposes new approach winter plan in response to statewide 4.8% infection rate, a rise in hospitalizations to 4,000 statewide. The state deploys rapid testing kits to school districts. The product selected has the potential of false positive and false negative rate. Problem is, the most accurate tests lack lab chemicals to process the tests. That is after 10 months of coronavirus plague. White Plains schools, since they began in-school remote policy, have a less than 1% infection rate over 1,500 employees and 7,200 students since September 8th. The Sonesta Hotel makeover of the Crown Plaza opens for business as of December 1st. White Plains will fund the Department of Public Works to measure emissions of cellular installation transmissions. A partial lunar eclipse wows White Plains, New York, USA. County Executive George Latimer removes ribbons of remembrance to observe passing of coronavirus victims. Now to the White Plains Week Rollo Newsreel March of Time. And White Plains, New York, USA observed a penumbral partial eclipse of the moon early Monday morning at 4:20 a.m. At its apex, the celestial event was cloaked in clouds. The Earth's shadow can be seen at the right side of the full moon. Clouds and gathering humid air obscured the crispness of the moon event. The eclipse, close up and personal, could be seen live from California and Arizona, and when it appeared in our area, the shadow of the Earth on the moon was very faint. But as you can see, in earlier hours on the west coast in the larger shot, and in Arizona in the smaller shot of the moon, it was quite defined. Governor Cuomo announced a new surge in coronavirus infections across the state. And here you see them. The first slide is the coronavirus regions in our area. Note Mid-Hudson. Now these are hospitalizations. And then in the second slide, you see the second coronavirus regions all across the rest of New York State. Every region is busting out in new COVID cases. White Plains teachers, administrators suggested in a letter to the superintendent and the Board of Education that the school district should take all instruction remote for 3 weeks to avert infections of children right now. Teachers and staff, and they would suspend school instruction 3 weeks. Superintendent of Schools, Dr. Joseph Ricca, addressed the school district decision on Facebook on Tuesday.
Lots of questions, lots of opinions related to so-called holiday pause, right? Going to full remote learning following the Thanksgiving holiday through perhaps the winter holidays, Christmas, Hanukkah, Kwanzaa, New Year's, lots of conversation, good conversation, a lot of opinions, strong opinions, all reasonable, and you can understand, and you'll see from some of the questions that we received today, that they're sort of on all sides of the board. So, as I had made mention at our last reopening committee meeting, and I'll do that right now again, is all of the options or all of the possibilities will always remain on the table with regard to how we approach each individual day, given what we're experiencing with regard to COVID-19, with regard to positivity rates, with regard to the regional landscape. But just know that, even if let's say you're somebody who's really advocating hard for a holiday pause, you're being heard. I hear you, the Board of Education hears you, and we respect everything, your opinion, and certainly appreciate the feedback. If you're somebody who's advocating for more in-person instruction, same. Hear you. All opinions are respected. What we're doing right now is we are attempting to be able to continue to provide in-person instruction to our children following the health safety standards that we put into place for as long as we possibly can, uninterrupted. We've been really fortunate. Have we had cases of COVID-19 pop up in our schools? You know we have. You see. Even yesterday you saw the updates. Have we seen spread in our buildings? Fortunately, no. We've not. And again, credit to everybody in our facilities, credit to everybody in our school community for doing what they can to minimize spread. That's what this is all about, minimizing spread. So we see numbers of COVID-19 going up all throughout the state of New York, going up throughout Westchester County, going up throughout the lower Hudson region, yes. Fortunately, we don't see any indication that there's massive spread in school facilities. I personally believe it's probably because school facilities are some of the most safe with regard to procedures and protocols, safe public facilities that are around, right? Way more health safety procedures in public schools than there are in, say, the supermarket. Not saying that the supermarket doesn't have them, they do. But all of these steps that we're taking every day are helping to minimize spread. Again, that's what this is about. Will a holiday pause have to go into effect at some point in time? Maybe. I don't know right now. What I can tell you is we're going to continue to focus and look at the data that we have each day to make the best possible decision that we can in the name of health and safety for our children and our staff members all throughout the educational community. So I really do appreciate all of the feedback. I also really appreciate your patience and your flexibility as we work through this. We knew this was going to be a tough time of the year, right? We know the holidays are a time for travel. We know the holidays are a time for gathering. We know all of those things exist. It's going to be the winter. Very soon we'll have cold weather. All of these things are going to factor into whether or not we have higher numbers of identified cases of COVID-19. So we'll keep you updated there. And we have another reopening committee meeting tomorrow, and as always, we'll post that reopening committee meeting so that you're able to watch it at your convenience. As we move into the winter holidays in December, it's December 1st already, right, today, we're going to continue to advocate to make sure that we're taking the appropriate steps at home, outside of school, to help us here at school to remain open to the extent that we're able. Following all of those health safety guidelines, physically distancing, making sure we're wearing masks, washing our hands, staying home when we're ill, all of those things that you've come to know over the last 10 months or so, 9 months or so, and that you've been working so hard on.
Governor Andrew M. Cuomo also announced his winter plan and his new testing guidelines to remain open if a microcluster infection rate designated it a yellow zone. Dr. Ricca asked about this in his Facebook briefing, explained what this meant.
Long and the short of it is this. All school districts, if they're designated in a particular zone, if they want to offer in-person learning, will be required to test their in-person student population. The tests that are going to be used come from the state of New York through the county and then are administered at the district level. They are the rapid antigen tests, and I know what you're saying right now. Those are the unreliable ones. Yes, those are the ones that are less reliable, certainly, than the PCR test. This is not a diagnostic procedure. This is a screening procedure, and there's a real important distinction there. This is a screening procedure to make sure that in this particular percentage group, whether it be 10, 15, 20% of in-person folks, that we're identifying a percentage within that group of positive cases. Those numbers are then shared with the New York State or the county, the New York State Department of Health, as well as the parents and guardians. So, if your child tests, you consent to the test. Your child comes to school, takes the test, tests positive. What happens next? You go home. You could engage your healthcare provider for PCR tests. Those are the tests that are a little more invasive and require a little bit more time to receive the determinations, but they are more accurate. To get an outcome there, or stay home for 14 days in quarantine. And if you're negative, you're negative.
Dr. Ricca also said the state is delivering the rapid tests Binax Now that, according to the MIT Technology magazine, have a 3% rate of false positives or false negatives, while the PCR tests have a false positive or negative of 2% of the time. NBC News reported 1 month ago that the more accurate PC tests that react positive only to the coronavirus itself also take results longer to get back to the state because they have to go to labs. NBC reported the more accurate PCR tests are not being supplied by the state because reactant agents that identify coronavirus only are not in enough supply to the state labs. This after 10 months of the red plague coronavirus. Dr. Ricca added that the White Plains schools are not in any risk of being designated a yellow zone because the school's infection rate is so low, as demonstrated by the New York State school tracker for the White Plains City School District. Here is what the Mid-Hudson Region infections look like in this crawl chart from the school COVID report. Total positives, 4,474. This is statewide. Total students, 2,169. Public schools, 1,881 infections. Charter, 288. Teachers and staff, total 953 infections. Total schools, 3,122. Private and charter combined, 493. And that is the state in the Mid-Hudson. That is in the Mid-Hudson. Now, contrast this with the White Plains School District since September the 8th. There's the White Plains School District Westchester lab positives, 85. Total students testing positive on and off-site, 44. Total on-site students testing positive, 23. Total off-site students testing positive, 21. Total teaching staff in White Plains testing positive on and off-site, 25. The total on-site teachers and staff, 15. Yes, just 15 infected. Total off-site teaching staff testing positive is 10. The total positives of students and teachers and staff is 69 as of the 3rd of December in White Plains, New York, USA. There are 7,133 students in the White Plains schools, and the district has approximately 1,300 employees and about 7,200 students. 8,500 individuals, teachers, staff, and students, and of that number, 69 have tested positive. That is an infection rate of 0.8%. Again, 0.8%. As the superintendent would say, good job, Taggers. On Wednesday, the School District Committee on Reopening met, and Maggie Rasiopa, school nurse coordinator, told how the district is doing.
I just want to say that one word that I can tell all of you is that I'm grateful that we're still here, that we're healthy, and that we're still plugging away every day. One of the things that I have to stress is that the distance and the masks are really working, okay? And the ventilation are really working. I do not see much spread within the schools. I do see that a lot of it is coming from the outside, you know, whether you have a sick uncle that you saw, or you saw somebody that was ill and you found out that person was ill a day or two later. So I'm seeing a lot of that. But within the building itself, I've only seen one or two cases that I could actually say that it came from, you know, somebody that spread it within the building. And I think that that's amazing with the amount of cases that I've seen. So yeah, it is. And I have to say that it is working, and I think that everybody's doing such a great job and just doing the best that they can. And it's a stressful and scary time in our lives, and we just have to support each other. So
Thanks.
I'm here for the families and for the community and for our staff.
County Executive George Latimer said in his only COVID address of the week, the Monday after Thanksgiving, Mr. Latimer said the last time the county had this many active cases of coronavirus was May the 3rd. The figures continue to go up Monday, Tuesday, and Wednesday as the update chart shows, and there is the COVID tracker as of yesterday. From Wednesday before Thanksgiving, November 25th, to Wednesday, December the 2nd, 3,977 persons tested positive coronavirus in Westchester County. The Westchester infection rate is 5.3% for 3 straight days. 13 straight weeks of increases is what we have experienced. The county executive said he supports keeping schools open and again pleaded with residents to wear masks and limit social gatherings. Westchester writes, only you can prevent COVID. The December 3rd county chart shows new cases all over the county, and there it is. Mayor Tom Roach reported in his weekly call to residents that 43 new cases in White Plains as of Monday had occurred, and White Plains has a good track record. Yet, by December the 2nd, that's Wednesday, the county chart reported White Plains had 65 more new cases. Yonkers, 296. New Rochelle, 103. Mercy. If I read this tiny type on the chart correctly, Ossining, 51. Mount Vernon, 37. North Castle, 98. Peekskill, 68. May I suggest the county make that box showing new cases bigger and send it separately blown up. It would be more informative to the public. Mr. Latimer dedicated ribbons of remembrance in memory of those who have died of the coronavirus and plans to move the memorial indoors to the county office building. The county executive also honored World AIDS Day Tuesday, saluting Linda Hakem, a dedicated advocate for those who, at risk for HIV for more than 17 years, would owe a great deal. She was honored with the Commissioner's Special Recognition Award at the statewide statewide recognition award day event on December the 1st. Hakeem manages the Westchester County Health Department PEP program, is one of 19 awardees selected statewide. PREP is a preventive treatment that, when taken daily, can prevent HIV in people who are most at risk, and PEP, or post-exposure prophylaxis. It is a medicine taken to prevent HIV after a possible exposure. This makes me wonder why, after 50 years of the AIDS disease scourging our communities, we do not have a vaccine for it, while companies have put together a coronavirus vaccine in about a year. Can we do this finally for AIDS? Now, Brenda Starr, my co-conspirator, tipped me that coming up on the White Plains Common Council meeting Monday evening, the city will authorize the Department of Public Works to develop a measuring device to monitor radiation emissions from cell towers. This is an initiative by the mayor, perhaps prompted by Ruth Moss and the 5G group, with the mayor to limit the known threats of microwaves. Kudos for the mayor to do this. Activists count. In another sign of progress, the Broadstone continues to grow rapidly over Mamaroneck Avenue. And there it is, seen from the side street. From now to December the 13th, you can also enjoy a holiday market on Waller Avenue in White Plains with 40 vendors. It's sponsored by the bid. Enjoy it and mask up. The Old Guard has raised over $6,100 for the Salvation Army this year, and you can still help support the Salvation Army by making a direct contribution, especially since the Salvation Army is not doing their kettle drive. The Old Guard reports that they expect to be off some 75% in collection of the dollars from the kettles that they're not going to stage this year. So if you can help this season, help the Salvation Army, please do. Give them a call. This is a picture of the USS Arizona on Battleship Row being attacked on December 7th and today it rests on the bottom of Pearl Harbor, a sad remembrance of the day of infamy. It was sunk on December 7th in the Japanese sneak attack on Pearl Harbor. It killed over 2,000 U.S. servicemen on that day. Remember Pearl Harbor. Governor Cuomo announced this week that his tracing teams across the state have discovered something very intriguing. 70% of new COVID infections across the state have been determined to be traced to close-in social gatherings and what Westchester citizens must do. Only you can prevent COVID spread, and here's a spot telling you how.
COVID hospitalizations are climbing nationwide. What can you do to stay safe? Be careful in small gatherings now. It may feel safe because you're with your family and friends, but over 70% of cases can be traced to your households and small gatherings. Be New York tough. Stop living room spread. It's up to all of us.
This is John Bailey. Good night, Jim Benaroff, and good night for White Plains Week.
This has been White Plains Week, news and commentary about White Plains, Westchester, and the world. The views and opinions expressed on this program were solely those of the participants. White Plains Week, produced by White Plains Citizen Net Reporter, and presented on Optimum Cable Channel 76 and Verizon Fios Channel 45. You may view White Plains Week anytime on the internet at whiteplainsweek.com, youtube.com, and wpcommunitymedia.org. For White Plains Week, this is Peter Katz speaking.